The information presented in this program is intended for a general audience. If you need specific pharmaceutical advice, please consult with your pharmacist or doctor.
Good afternoon, everyone. Welcome. We have Dr. J.J. Allen here with us today. And I was going to ask one thing, because we are recording this and we are going to be playing it on EVTV and also sending it out so we can put it on YouTube channels so others can hear the great speaking and talk that he has for us. If you can wait, if you raise your hand to ask a question, but wait until I get to you with the microphone so everyone can hear it and the audio also picks it up on the video recording as well. So with further ado, I will let him introduce himself.
Perfect. Awesome. So first of all, thank you guys all for coming. This is one of the coolest places I've presented in with how big the screen is. This is an excellent venue, so thank you, Aaron, for having me. And then, for those of you guys who don't know me, like Aaron said, I'm a doctor of pharmacy, and as you guys will see, some of my passions lie in nutrition and lifestyle medicine, so it's something on the traditional medicine side. We do a very good job of diagnosing whether it's hypertension, hyperlipidemia, diabetes, and finding the right medication to treat those. And as a pharmacist, it's my job to make sure that people are on the right medications and make sure those medications are working well together. What we kind of do a poor job on is how to support these things with lifestyle and with dietary supplements. And unfortunately, with dietary supplements, there's not a go-to healthcare professional to talk to about them. It's something that's kind of been left to kids at GNC, kids at a nutrition store. And I worked at GNC when I was younger, and I talked about dietary supplements. I had no idea what I was talking about, but it's something that, unfortunately, a lot of healthcare professionals just kind of say, I'm not sure about that, I don't know, I'm not sure. And then where people are getting their information is online. So the highest selling dietary supplements, for the most part, are ones that have the best marketing campaigns. And as you'll see, we'll talk about a few of them here, and there's some that work well and have good marketing campaigns, but a lot of them have a lot of marketing, but not a lot of science to them. But there are things that we can leverage as dietary supplements, which we'll find out as we go. Can you guys hear me okay?
We can hear you too well. It's like your glass.
Okay. I think of my IT. Is that a little better? Okay, how about now? Testing. Perfect. Okay. Thank you. All right. But so we're going to get into a lot of nuance, and honestly, I have probably about 6 hours worth of content. So I've put, and we have an hour, and I want to be respectful of your time. So I put kind of the most common things that are coming up when I talk to people in the pharmacy. I'll have some anecdotes, some stories, and then we'll talk about some strategies you guys can use for picking dietary supplements and whether maybe you should use a certain one and maybe not. And as you'll find out, there's a lot of personalized factors that come into it. Just as not everybody should be on a statin, not everybody needs to be on, say, apple cider vinegar, which is one of the new, or not new, but it's coming back again as a popular dietary supplement. We'll talk about the nuance there. I do want to just briefly talk about, again, my background. So I'm a doctor of pharmacy, I'm a nutritionist, and I'm involved in the supplement industry, so kind of my passion is helping navigate people from the traditional to the functional world. And I'm fortunate my wife is a nurse practitioner. She's a functional nurse practitioner, so she does a lot of lifestyle medicine specifically. She practiced at Aurora for a while as a family practice nurse practitioner, and now she's at Green Medicine of Wisconsin. They work with a lot of people with fibromyalgia and other issues, and they concentrate on nutrition and bioidentical hormones and other compounded medications. So we have a lot of good discussions. I learn a lot from her, and I'm also very fortunate for the staff that I have at my store. So if you guys ever been at Sawyer Street Hometown Pharmacy, which I see a lot of familiar faces, I'm able to go out and give these presentations because of my great staff. So if I say anything and I'm not in the store, we have meetings. We just had a meeting this morning, and we talk about these things as well. So always feel free to ask one of my staff, and they'll be happy to help. So how about dietary supplements? So I think the big question And actually, when I just was checking in at the front desk, I was asked, so you're giving a presentation on dietary supplements, so should I take them? Are they all junk? Which one should I take? And that's a very complex question to answer because there's so much nuance and interpersonal variability. It's kind of like asking, which medication should I take? Without knowing your health history, without knowing your baseline status of nutrition, without knowing what is your goals. Do you have arthritis? Do you have hypertension? Do you have heart disease? It's a really tough question to answer, but dietary supplement companies will make you think it's easy. You just need their dietary supplement. So I think that the most important thing is if you're taking a dietary supplement, talk to a doctor of pharmacy, talk to a nutritionist who kind of is interested in it and actually looks at the research to see if it's helpful. And there's a lot of things, I'll be completely honest, there's a lot of dietary supplements out there that have a mechanistic potential for probably working, but there's not a lot of data for it because there's not as many trials on certain dietary supplements as drugs. So there's some cases where people will walk into the pharmacy and they'll say, JJ, I'm taking this dietary supplement, what do you think? And I'll say, well, I always look at things with a risk-benefit ratio, and a lot of them there's very little risk with, but I'm not sure how much benefit there is, but if it's helping you, the worst it's going to do is make your pocketbook a little bit lighter, so go ahead and take it. So there's a lot of those, and there's a lot of things that we can leverage that I'll talk about in this presentation today. But I think the most important thing, if you see an ad for a dietary supplement, just like if you see an ad for a prescription medication, you can't just go and get that prescription medication. You have to talk to your doctor first to get a prescription. Same thing with dietary supplements. And that's what we're happy to talk about as you come into our pharmacy. We have different than some other pharmacies that our pharmacists are trained and have a passion for and actually go to our 75 different stores, and we work with pharmacists to give them more knowledge. Because we have the pharmacology, we have the pharmacotherapy, but we're only taught drugs in school, so it's really on us to learn how we can leverage dietary supplements as well. Before I talk about anything specific, I just kind of want to talk about why picking a dietary supplement, it's a little harder than going in and getting, say, ibuprofen, or you have a cough and you're going in and get Tussin DM. Because with these products, ibuprofen, you have ibuprofen, then you have the brand Advil. We have the generic and the brand. Does anybody know the difference between a generic ibuprofen and a brand Advil? Nothing. Yeah, it's the name on the box. So you pay more for the brand name Advil. Maybe it's $8 for 50 tablets. Maybe the generic ibuprofen, the same exact ibuprofen, 200 milligrams, it's $5. So you're paying for that brand name. And the reason we know that those are equivalent is how they're regulated. Drugs are regulated in such a way that it's required that they get third-party tested, that we know exactly what's in both of them. So when you're getting over-the-counter products, these are things like cough syrups, ibuprofen. These are things I'll usually recommend generics for because getting the same result and it's more cost-effective. For dietary supplements, that's not the case. So they were originally regulated as foods, and now after 1994, if you remember DSHEA, the Dietary Supplement Health and Education Act of 1994, they're regulated somewhere between foods and drugs. So the regulations aren't as strict as drugs, but more strict than foods. And I'll talk to you about what 4 things. If you want to learn more, feel free to go on those websites, but you don't really need to. The 4 things we look at, so all medications, so say statins. Simvastatin is a very common medication. Before it gets FDA approval, it has to be tested for efficacy, or does it work? It has to be tested for safety. Will it do no harm? And we know medications have side effects, so they have to report what side effects there are. So in certain situations, if we dose statins too high, it can cause harm, but because it's reported, we know what harm it might cause. Quality, is the product consistent and pure? So for medications, this is the case. You guys might remember some recalls from 2 years ago. So yes, there are some things that slip through that get to the consumer, and then they realize after things slip through the cracks. And you'll see with dietary supplements, more things slip through. But for drugs, in general, the brand and the generic is the same thing. And the last thing is therapy, and this is important, is how do I use it? So drugs are regulated. In the trials that they do, they give somebody a specific milligram of a drug versus a placebo. And in that trial, that's how the guidelines are based. So if, say, 80 milligrams of simvastatin lowered someone's cholesterol 15%, or LDL cholesterol 15%, we can make an algorithm and a guideline for using that. We don't use 80 milligrams of simvastatin anymore, but that's besides the point. So for dietary supplements, there's 2 of these 4 that the FDA regulates with them. I know we don't have a mic, but I'll say, can anybody guess which 2 are regulated? Safety. Safety is one. Quality, which you'd think, it's kind of weird. So the 2 things that are, see if I can do this. Well, I can. The 2 things that supplements companies have to follow with the FDA are quality and safety. So basically what this means is, will the supplement do no harm if used as said on the bottle, and quality, are the batches peer-to-peer from bottle to bottle? So the important caveat here is the FDA regulates this, but the FDA doesn't have the manpower to really enforce this. So there's a lot of things that get passed that aren't a quality product and that aren't safe. But in general, dietary supplements are regulated based on quality and safety. The reason I bring this up, they're not regulated on efficacy or therapy. So basically, it means that somebody could sell, say, vitamin D 1 IU as a dietary supplement, and 1 international unit is a tiny, tiny dose. And they could sell that, but 1 international unit is a drop in a bucket. So is that efficacious for getting somebody's vitamin D up? No, it's not. But it might meet from batch to batch. It might have 1 IU of vitamin D, and it might be safe, might cause no harm. So dietary supplement companies can basically put sugar or lactose in a pill and say, it's safe, and it's the same from batch to batch, so go ahead and take it. So I think this is why I'm so passionate about this, is there are things in dietary supplements that do work and can be helpful, but an important thing is, how do I use it as well? A lot of the dietary supplements are overdosed or underdosed. So just by saying, someone should say, hey, I should take vitamin D, or I should take vitamin C, or I should take N-acetylcysteine, the important thing is, well, what dose, how often, and how frequent? And they can't say that on the bottles because the FDA does not regulate that. So there's a lot of nuance there, but just know that when I go through these examples, dietary supplements are regulated on safety and quality, but not therapy and efficacy. This is one I bring up all the time. So I think, has anybody heard of Prevagen? Yeah. So they probably have some of the most marketing dollars there is, and they've actually got even the pharmacy magazine, Pharmacy Times, to endorse them. And if we look at these 2 things, the products are safe, I'll give them that, and the product is consistent and pure. The problem with it is there's not much data that it actually works. So it's something that's one of the highest sold dietary supplements, and it even says, Pharmacy Times, #1 pharmacist recommended brand. I don't know. And unfortunately, when I talk to some of my colleagues who are in stores, they're fine with recommending it because they know it's safe, but a lot of times people are just wasting money on it. And the reason why it's the #1 pharmacist recommended brand is they do a lot of great in-store marketing, and they try to sell pharmacists on the specific study that actually didn't show it was helpful at all, and then pharmacists will sell it. So it's something that we need to do a better job as a profession of recommending things. So Prevagen, and my marketing person put this on there, Prevfaken, and I laughed and I said that she said she meant to switch it back. I said, no, leave it. That's funny. But basically, they have so much marketing dollars, and they have so much dollars meant for lawyers' fees. So there's a big class action lawsuit with Prevagen, but they're making enough money because they're selling so much product, and it's a quality product because it's pure from batch to batch and it's causing no harm. So the FDA doesn't have much recourse. The FTC, the Federal Trade Commission, can sue them for claims that aren't true. The improves memory isn't a true claim. But basically with Prevagen, just know if you're taking it and it's helping you, I've ordered it for a few people because it does cause no harm. And if people think it's helpful, I just let them know, like, hey, you're probably spending money on something you don't need to spend money on. But if it's helpful, it's probably safe. What the theory is there's this protein, apelquinone, I think it's called. It's a jellyfish protein that was supposed to get absorbed, go to the brain, help with neurotransmitter things. But when you look at the data, the protein, like when most proteins, we eat meat, we eat things, it all gets digested into the individual amino acids, and you're just absorbing the amino acids. So you're better off just eating chicken. So Prevagen is an example of a product, and unfortunately, this is why a lot of healthcare professionals and doctors are learning about this story, that they just poo-poo dietary supplements altogether, because Prevagen has a lot of marketing dollars, and there's no data that it actually works. But again, if you feel like it's helpful, just so you know that the clarity, I don't stock it on my shelves, but I do special order it for a couple people. But I explain this very clearly to them. On the other end of the spectrum, is any of you guys familiar with N-acetylcysteine or NAC? And it's something that's not a common thing that you'll hear in the news, but N-acetylcysteine is something that was originally a drug. So it's something when someone goes with a Tylenol overdose, they accidentally ingested too much Tylenol, they'll give them a very, very high dose of N-acetylcysteine, and the N-acetylcysteine helps to make sure it's not toxic to the liver. And there's a battle going on right now. It was actually, if you go on Amazon, you can't find N-acetylcysteine because it's a drug and it's a dietary supplement, and the FDA is saying, well, it was originally a drug. We don't think you should sell it as a dietary supplement. So the problem with going that, so I just want to kind of paint the picture of, I'm not for more regulation, I'm for more clarity, and I think we need to do a better job as professionals, is N-acetylcysteine actually does a better job than Mucinex for anybody who has chest congestion, anybody who has COPD, anybody who has asthma, and it actually was a very good therapy when they were using it for people with pneumonia as well. And I have a few patients who will come in, get N-acetylcysteine in vials via nebulizer, and it does a great job in the lungs. But before you get there, a lot of people just want this, don't go to the doctor, just want something easy over the counter. N-acetylcysteine in a capsule is something that's very effective for clearing up mucus. It's a precursor to glutathione, your body's master antioxidant. And more importantly than that, it's ridiculously safe. It's very, 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 very safe. I would much rather give somebody N-acetylcysteine than give them Mucinex or give them some other cough suppressant. Because this supplement, which it's a supplement when sold over the counter in the pharmacy, and it's also a drug when used in the hospital, is very effective for cleaning up the lungs. So one takeaway from this, if you have chest congestion or if you have a productive cough, you want to help to get that up. Number one, drink plenty of fluids. Number two, add N-acetylcysteine. If we look at the studies, it's about 600 milligrams of N-acetylcysteine. So it's much better than Mucinex. But it's trying to be pulled off the shelf. So N-acetylcysteine has no marketing behind it. Nobody's heard of it. But it's very, very effective for what it does. And it's pretty cheap. It's pretty inexpensive. Prevagen, there's a lot of marketing behind it. They have a lot of money for it. It doesn't work, and people know what it is because of the marketing. So it's really we need to do a better job as healthcare professionals of talking about these things. And these are two that I like to bring up just because of the dichotomy between the two. So there's a lot of other things like this. So one thing I want to bring up too in the dietary supplement world is, again, we're not assessing it for efficacy. So I could make a product, say this airborne gummy, and I could put a little bit of vitamin C, 1 milligram maybe. I could put a little bit of elderberry, a little bit of echinacea, and make this proprietary blend here. So you see this proprietary blend is 35 milligrams. Can anybody tell me how much echinacea is in Airborne? Yeah, so you can't. So so this is a good tip when if you're choosing dietary supplements, just like you don't know. So how proprietary blends work is they list the total milligrams, and then they have to list the ingredients by quantity. So there is echinacea is the last ingredient. There's the least amount. I don't know if that's 1 milligram, 0.5 milligrams, 0.2 milligrams. As a pharmacist, I don't know what to do with this product because I don't know how to dose it. And does anybody know what the first ingredient is? That maltodextrin. Does anybody know what that is? Sugar. So basically, it's an expensive gummy bear. So the first ingredient in this 35 milligrams is maltodextrin, which is basically sugar. It's a sugar. So if you're looking for products, an important thing, and again, this Airborne is safe. It's probably the same from batch to batch because they don't have to say what quantities these are. But is it effective? I don't know. We don't know the dose. So then we look at another supplement here. So basically, this is just one. When you're looking for a specific product, one easy way to tell if the company's trying to hide something or not, and there is exceptions to this, but normally when there's a proprietary blend, there's no reason for a proprietary blend in the supplement world other than to hide something. So basically, they're making this proprietary blend because people will look at it and say, oh, I know ginger is good for a cough. Echinacea is good too. This must be a good supplement, but the dose is so low, it's probably doing nothing. It's probably causing no harm. They taste good. I've had them before. They're just expensive gummy bears. Then you look at a product over here, Evolve Immune. It has things listed out line by line. It has things that are specifically shown for what compound actually helps. So for Astragalus, for example, the polysaccharides are what we look at for the studies for immune health. But if we look at it and we want to use this product specifically for clearing mucus, and I see N-acetylcysteine, is the 300 milligrams enough according to that study that we saw? It's not. So it's for this product, and I make this product, but I just wanted, so the 300 milligrams is one, we compound this, is one that if we're using it specifically to clear mucus, this is not the right product. We just want plain N-acetylcysteine that's cheap in higher doses. But if we're using it to help to support the immune system, so we use this a lot, people traveling, going on planes, not something you necessarily need to take every day, but something before going to antibiotics, elderberry, N-acetylcysteine, echinacea, astragalus, in these doses can be a helpful tool. But it's something just to know that if someone's having mucus issues, I'm just going to recommend a plain N-acetylcysteine. If someone's going on a plane and they might want a little bit more immune support, I'm going to recommend a product like this that has some elderberry, has a little N-acetylcysteine. And if someone wants an expensive gummy bear, I'm going to recommend the Airborne. So these are just examples just to show you guys that there's a lot of things in the dietary supplement world that can be helpful. But the problem is that they'll market certain names and they'll say certain things like elderberry is good for cough, but what dose of elderberry or vitamin D with the immune system, vitamin D is helpful, but at what dose of vitamin D? And there's certain things that we can measure. Vitamin D is one of them where we can get a blood level and each person's dose is different. Other things we can't, but just know most of the highly marketed dietary supplements, they have a lot of marketing dollars and not a lot of science behind them. I do want to do a couple other good news that there's a lot of data for CBD for chronic pain. So CBD is something that I do recommend quite frequently for chronic pain. And yes, we also dispense things like NSAIDs, naproxen, ibuprofen. We dispense narcotic medications, hydrocodone, oxycodone. We dispense things for nerve pain like gabapentin and Lyrica. And all these things have their place and can be helpful. But the reason I like to leverage CBD first, unlike the ones I just it's said, which I think you guys are familiar with, some of the narcotic medications that can be effective but have a high side effect profile. For a lot of my patients, starting before going to a hydrocodone or helping someone get off a narcotic medication, CBD can be an effective tool for chronic pain. It's something that was marketed heavily like 3 years ago, and thankfully some of these shops that are just selling CBD are closing, but you can find it at the gas station, you can find it everywhere. And CBD is one that's marketed well, and it's effective. But the most important thing with CBD, because there's so much money in it, there's a lot of people making products that don't actually have any CBD in it. And even worse, there's a lot of products that have pesticides, heavy metals, things. So when you concentrate a hemp plant down into a tincture, no matter what, if the plant had pesticides on it, if there's heavy metals in the soil, all of that's getting concentrated down into a vial. So if the company is not having proper practices, not testing at the end, third-party certificates analysis, there might be things in the CBD that's not helpful. So this is one reason that doctors at first hesitated to recommend it, and now there's certain companies that they will recommend using. The important thing with CBD to realize is, and there's so many different brands, people will ask me, like, does this brand X, is this a good one? And honestly, I usually say, I don't know. I'd have to look at the certificate of analysis. But if you take CBD, one important thing to make sure that that company does is does a third-party certificate of analysis, and almost all of them that are quality companies will. So they should have a lot number that you can go on their website and type in that lot number, and they'll be transparent. Unfortunately, because that we saw, the FDA can't really keep up with these things, so it's something that when you're buying CBD, unlike ibuprofen, usually those low-cost things at the gas station probably don't have any CBD in them. If you go to the gas station, they have ibuprofen, it's good to go. But CBD can be a helpful tool, but just know that there's a lot of junk out there. And I'm going to share some brands in general just in a second, because I know that's probably the question, what brands do I recommend sharing? And because of time, I'm not going to spend too much time on this, but there's a lot of, if you're going to buy things online, it's fine. Just making sure that you're buying from the manufacturer directly, because particularly for products that have a high margin, like Align is a pretty expensive probiotic, there's a lot of counterfeit products, just like for expensive, I'm not a fashion person, so I don't, like Louis Vuitton purses and the fancy watches, there's a big market for counterfeit products that are expensive. So someone might sell you an expensive watch, I don't even know the brands, but a Rolex, like an expensive Rolex, and they say, hey, I'll sell it for $50. Is that a real Rolex? No, it's not. And in my opinion, if you can't tell a difference of the Rolex, does it matter? I don't think so. But with dietary supplements, it does, because they might put something in there that's just powder or not in there. So you can buy online. There's no problem with buying online, but just making sure you're buying it from the company directly, so you know the supply chain. So a lot of things on Amazon that aren't from certified stores have been shown to be adulterated or something that's not in there. Another thing you notice when you come into any hometown pharmacies, we're kind of like Whole Foods, where we don't have any cheap dietary supplements. And I learned this the hard way when I first opened my store 6 years ago. A lot of pharmacists go like, oh, all dietary supplements are the same. I'm just going to get the most cost-effective things. But the more that I learned, talk to my nutritionist friends, talk to my friends that are in the supplement industry, like, JJ, you can't sell cheap dietary supplements. You can sell cheap ibuprofen, but dietary supplements aren't the same way. Most value brand dietary supplements, there's some steps that are being skipped, and like that we showed, dietary supplements are regulated for quality and safety, not for efficacy or therapy. A lot of them that are value brand are ones that don't get absorbed. They are the expensive urine that your doctor will tell you, and they're just not helpful. So it's something that there's plenty of cheap dietary supplements we can leverage from good companies that if you're going to take a dietary supplement, take one from a reputable brand. It's important. So these are some brands, and I have no affiliation to any of them except for the First one, we'll disclose that we only have a couple supplements. Evolve Wellness is a company that I consult with, and it's a company owned by pharmacists and some nutritionists, because we're finding products that we can source the raw materials, test them through third-party companies, and save our patients money. But other ones that I have no affiliation with that you can find at a lot of professional sellers, so like myself, other functional doctors, physical therapists who are good will sell these. This is one thing that chiropractors actually do better than pharmacists, is they have, there's better quality products if you go to a chiropractor for supplements at your chiropractor than you'll find like in a Walmart or Walgreens. And these are just some examples. There's a lot of other good brands, but all of these brands are what's called professional brands, so they're only sold through healthcare professionals, and you can also order them online directly through their website. But they're a little bit higher cost. The reason is they have the testing at the end. They show that the absorption is there, and it's something that that we know from the dosing that they have can be effective. The one thing, they can't really make any claims on the bottle, so it's important to talk to a pharmacist, talk to a dietitian about what dose you should use it, because they can't say on the bottle how to take it or how many to take. They just have a general statement on there. But for some products, it's 1 capsule a day. Other products, it's 3 or 4 capsules a day, and they really can't say on the bottle. So if you take something like this, just ask your pharmacist. They'll be able to help you with that. But there's other good companies too. So if you take another company, it's not on here, it might be good too. These are just ones that are kind of the gold standard in the industry. And the cool thing with Orthomolecular, they're actually, they have the manufacturing plant in Stevens Point. So I've been able to tour their plant, and I work closely with some of them. No financial relationship with them. They just do a good job. I do want to mention one thing. Do I have 15 minutes? Okay. I just want to make sure I'm respectful of everybody's time. There are other things within professional companies. So this is Orthomolecular. So a good company we talked about. And ubiquinone or CoQ10 is something I'll recommend quite frequently to my statin patients or people on beta blockers or some people with muscle cramping or muscle pain. It can be a helpful tool. There's a lot of companies that will try to push ubiquinol, which is, which is on the right side of the thing. And the difference between the two is the redox status. I don't need to go through a chemistry lesson here, but basically your body will put these back and forth so it has a balance. So no matter which one you take, your body is going to change ubiquinone into ubiquinol and vice versa. So your body can do this. There's companies that will market ubiquinol as the better absorbed, the one you need to take, and guess which one costs more? Yeah, the ubiquinol costs. That's all right. That's fine. And there's, because the ubiquinol costs more. And there was old studies that said that ubiquinol was better because that's what your body actually uses as an antioxidant. The newer studies are showing that so we take these oral, when it goes into your GI tract, the ubiquinol is made into ubiquinone. So by the time you absorb it, no matter if you're taking ubiquinol or ubiquinone, it's all getting absorbed as ubiquinone. So it's not unsafe to take one or the other. And I've had a few people say, hey, JJ, I know I'm probably getting the same thing, but I just feel better on the ubiquinol. So go ahead and take it. But it's important to realize the end result for these with the research is the same. So you can save some money by buying ubiquinone versus ubiquinol. And about 95% of people that I switch, they notice the same thing. Again, there's 5% of people that are outliers. And again, there's some things in studies that we just don't know. And some people, maybe they don't convert it, and maybe they do absorb it better. I'm not sure. But this is one that even within professional supplement companies, they market to buy the ubiquinol because they make more money if you buy the ubiquinol versus CoQ10. And CoQ10 is something I do recommend quite frequently to people on statins and beta blockers. And you can get it from food. Does anybody know what food might have high CoQ10 in it? If you see the heart there. So it's so if you eat heart and liver as well, so it's so CoQ10 is one that your body will use in your heart. You need it a lot for ATP production. So it's really high in heart. So if anybody's had beef heart or beef liver. There's some so things that people don't eat that often, but it's just something that you can get from food if you eat organ meat, but most people don't. Another important thing with CoQ10 that I think some people miss, it's a fat-soluble nutrient, so it's something you can get much better absorption by taking it with some food, particularly a fat. So I have a lot of people who are able to take a lower dose of CoQ10 and get the same benefit from it, say 100 milligrams versus 300, just by taking it with some food. So important supplements that are common to take with food are CoQ10, then the fat-soluble vitamins. These are vitamins if you take vitamin D, vitamin A, vitamin K, or vitamin E. These things get absorbed better if you take them with some fat. So, and I have so many more examples. I've given a lot of like general overview presentations. I think a lot of you guys have been there. So I wanted to get to some more specific things for you guys to kind of go through what goes through my mind when making recommendations. Another important thing, and I get this question again, let me bring this up, what dietary supplements should I take? There's really two ways to use dietary supplements. So there's the way that a nutritionist might use a dietary supplement. So I do with all of my consult patients. I've fairly extensive data I want them to give me, just because, like I said, there's a lot of nuance between person to person for who I might recommend something. But the first place we start with is correcting deficiencies. So I'll have people do a food log, and if you guys like apps or savvy with apps, there's an app called Chronometer that you can put in. Just kind of, most people eat about the same thing every day, so just a week, just log what you eat, and then it'll pop up a different chart showing you what nutrients you're getting, what nutrients you might be overeating, a lot of times, me too, fats and carbohydrates, and what things you might be missing out on, what micronutrients you might be missing out on. Then it can make some suggestions for foods, but then if we can't get them from foods, we can correct them with dietary supplements. So the place to I start with everybody is, let's do a food log, show me what you're eating. If you do consult with me, we'll do this, and then we'll go through and see what we're missing. The other way to use it, and again, there's a lot of complexity with medications, depending on your disease states, depending on what else you have going on in your life, is we use dietary supplements as pharmacological therapies. So you think of correcting deficiencies more like a nutritionist. They're looking for things in the diet people are missing. So a lot of people don't get enough vitamin D. A lot of people don't get enough magnesium. A lot of people don't get enough omega-3 fatty acids. So they'll first say, how can we add these in with food? So for magnesium, they'll add those in with some nuts, maybe some kale, some dark leafy green vegetables, help to get the magnesium up. Maybe for omega-3s, it's the smash fish, sardine, mackerel, anchovy, salmon, herring. Some people might say, you know what, Doc, I'm not going to eat those. Then we say, okay, then we can leverage a dietary supplement to get those up. And we do those at such a dose that's not a high dose. It's a dose just to get things up where they should be to help prevent disease down the road. So for these uses of dietary supplements, people aren't going to feel a difference. You might not see a difference on lab markers, but it's just making sure, just like with nutrition, if you eat nutrient-poor foods, you might not feel it then, but down the road, we might have issues. The other way to use dietary supplements, and a lot of people forget about this, is pharmacological therapies. So as a nutritionist and a doctor of pharmacy, the way that when I came out of school, when I think about drugs, we think about using them in a dose that's such going to augment a system in the body. You can also do this with dietary supplements. So you'll see on the back of some dietary supplement bottles, the percent daily value is just crazy. And for most people, you don't need that to supplement your diet, but for certain things, like when we talked about supporting the immune system, there's pretty good data for when you first start getting a cold, taking high dose vitamin C that you won't be able to do that by getting an orange, but from a day-to-day supplement, most people can get enough vitamin C from eating citrus fruits, eating green peppers, things like that. So there's two ways to use dietary supplements. That's usually the first thing when people ask me, JJ, what dietary supplements should I take? First the question I ask is, well, what's your goal? What do we want to do? And then we'll ask, what's your diet? And then I've got, at the end, there's just a quick, it's a good handout that kind of goes through your diet that talks about the most common missed nutrients from diet, and it talks about what foods to get them from. So I'm going to go through the diet, and then we say, okay, what medications are you taking? There's certain medications that require you to take a higher nutrient, like if anybody takes methotrexate, they're probably common that their doctor recommend folate or folic acid with that. Just like if anybody takes statins, it's often recommended to take CoQ10 with the statin because your body has a higher requirement for that. On the opposite side of that, there's some drugs that we need less of a nutrient for. Is anybody on warfarin or Coumadin? No? Okay. Yeah, is there a specific dietary restriction or something that the doctor tells you not to eat? Or Yeah, kale. So with warfarin, warfarin works as a vitamin K antagonist. So for my patients on warfarin, we need to be consistent on the amount of green leafy vegetables we're getting in. And we need to make sure that when someone's taking a dietary supplement, even a multivitamin, is there vitamin K in that? Because that's going to affect how the warfarin works. If we give somebody more vitamin K than they're used to, that warfarin is going to be less effective. So there's a lot of nuance from person to person on what dietary supplements can be helpful for person A might harm person B. So this is where, again, just talking to a nutritionist or a pharmacist that dives into this is super important. And I want to be respectful of your guys' time. I can't quite see the clock. 2:15, so I got 15 minutes. Is everybody still good? Okay, we'll keep going. Then we'll get to some questions here. I do want to talk about a couple big picture items. And I could talk forever on this. Obviously, very passionate about this. But I want to be respectful of your guys' time and stay around for any questions you guys have. So an important thing when I go through, when I sit down and have consultations with people, or I'm just filling a prescription for somebody, the first thing I'll usually ask myself is, so they're on these medications, they have these disease states, what can we do to leverage lifestyle that they'll enjoy doing that might help them lower their blood pressure, lower their cholesterol? And this is really the foundation. So we look at specific nutrition, we look at movement, we look at sleep, and we look at stress. And I'm fortunate to have on my team a registered dietitian. I have some PhDs in exercise physiology. And then I have other people in the community that I refer people to, like Dr. Eric Kaler at the Physical Achievement Center, my wife, a lot of great doctors at Aurora. So there's places that we can leverage lifestyle first. And then what I'll ask myself is, okay, we've leveraged lifestyle. Their cholesterol is still high. They might have familial hypercholesteremia, hyperlipidemia, high cholesterol. They're doing everything right with their diet. All right, we got to look at either a dietary supplement or a drug to help this person. So then I'll ask myself, of these products, so after we've done the nutritionist approach, I've helped to make sure they're getting enough omega-3s, they're getting enough vitamin D, they're getting enough other nutrients in their diet. This person's cholesterol is still high. What can we do? So then I ask myself, what therapy in my toolbox has the highest benefit with the least amount of side effects? And usually for cholesterol, for example, we'll leverage things first if someone's on the border, like things like bergamot or berberine, which are dietary supplements. They're plant products that have been shown to lower LDL cholesterol, but they don't affect the HM-CoA reductase. So they don't affect this enzyme that's also needed to make CoQ10. And then if we do that and we see, okay, we can't quite get them down enough, and we know the data is pretty darn good for statins for someone who had an MI, then I might say, okay, we need to get you on a statin, but we need to make sure we get you on a statin that you can tolerate and don't have side effects. So I think this is what it's kind of missed, that we'll see an LDL, and so we'll see a high cholesterol, and before saying, okay, you're on the borderline, how can we prevent this? How can we get this down with lifestyle? How might we leverage a nutrient? We just jump right to statins. Not that that's good or bad. Statins are very helpful. If you're on a statin, keep taking it. But it's something that if you're interested, if your doctor's saying your blood sugar is getting a little high, I think we might need to start you on metformin, or I might need to add something to metformin. Oftentimes, there's other approaches that we can take before going to medication. Again, I dispense medications all day. Medications aren't bad. They're not good. They're tools. And these other things are tools as well. And unfortunately for the dietary supplements, there's nobody taking ownership of it. Either the doctor says it's all expensive urine, or you go to your chiropractor and they do a good job, but they say, and I know good ones, so good ones don't do this, but they'll say, don't take your statin, don't take your drugs, just take all these dietary supplements. But in reality, it's somewhere in the middle. They're tools, and we can leverage all the tools to get the best benefits with the least amount of side effects, and that should be the goal. If you guys are at my last presentation, this is the main reason why most people can benefit from doing a food log. Is the most common fruits or vegetables in the United States that we're eating are potatoes and tomatoes in the form of ketchup and French fries. So obviously we need more nutrient-dense diet, and there's ways to do it that taste good too. I like French fries, I like ketchup, but there's other things that we can do to improve these things. Another thing now, and you'll hear this a lot, is that the food we're eating now is not as nutritious as it used to be, and it's true, but you still want to eat broccoli, we still want to eat whole foods, but this might be an argument that we should get most of our foods, just like I want to know where my dietary supplement came from. I want to know the manufacturer. I want to have transparency. If you have the means, getting a food where you know the farmer, you know how they grew it, you know they have good quality soil that's having all the minerals, like say at the Oshkosh Farmers Market and other trucks as well, that you're going to get higher levels of these nutrients in fruits and vegetables. So store-bought vegetables aren't bad. They're a good tool, but they have less micronutrients than they had before. And again, before jumping to dietary supplements, it's find a farmer that you know. There's some great ones at the farmers market, and there's other great tools around the city for getting vegetables and things that are grown in soil that's not depleted of these micronutrients that can be even more energy dense. And this is not an argument to eat packaged food that has fortified nutrients in it. We should still be eating whole foods, but just know the source of that whole food does matter, but it's still fine to eat commercially grown whole foods. It's much better than the packaged food. But it's just another reason some people can benefit from dietary supplements. I do want to show these because these are when we look at nutrients, most people are missing. So this is natto. Most people don't eat that, but vitamin K2 is something that most people are missing from their diet. Omega-3 fatty acids, I love this sardine company, so eating sardines is something that most people can add more. Smash fish, sardine, mackerel, anchovy, salmon, herring. Obviously more fruits and vegetables, no matter if they're store-bought or from the farmer's market. Farmer's market, someone you know is better. And even organ meat. So organ meat is very nutrient-dense. Or liver has a lot of iron. It has a lot of B vitamins, a lot of different nutrients. And maybe you guys ate it more. I know my grandma ate a lot of liver. They ate kind of nose to tail. But we don't eat those things anymore. So those can be helpful too. And then sometimes it's not getting it from nutrients, but vitamin D, going outside is super important. I stay inside and I do pharmacy things all day. So I'm not getting outside to make the vitamin D as I should, so I take a vitamin D supplement. And then doing other things. This is Dr. Rhonda Patrick, who's making a green smoothie, and I've got a lot of green smoothie recipes. So there's other ways to do this to get nutrition from food, but sometimes we need dietary supplements. I just wanted to show this. This is something I've done full presentations on, the triage theory from Dr. Bruce Ames. So these are things that you might not feel, but most people aren't getting enough vitamin D, vitamin E, magnesium, even when we look at food and supplements. So again, this is just a reason that we want to be mindful of what we're eating because it can lead to diseases down the road or now that we want to avoid. So this is looking at nutrients more from a nutritionist perspective. They want to get these things up where they should be. And no, it doesn't mean you need to take every supplement. It just means that if you don't like to eat salmon and fatty fish, you might benefit from omega-3 supplement. And if you look at some of the most recent studies, taking really high doses of omega-3s might not be as helpful for the heart as we thought. But for people who don't eat any omega-3s, taking some omega-3s can be impactful. I just want to mention, just because people have a lot of questions on The immune system, one of the cheapest things that people can do just to be on, like if you're just going to take one supplement that most people can benefit from is vitamin D3. And taking that with vitamin K2, particularly if osteoporosis, is important. Vitamin K2 is kind of the forgotten nutrient. Doctors talk a lot about vitamin D and calcium for bones. Vitamin K2 is needed to help to shuttle that calcium to the bone. So as long as you're not on warfarin, and if you're on warfarin, you don't want to take this, if you're taking a vitamin D supplement, look for one with vitamin K2. And a lot of the professional companies will have it with K2. But this is just something from when we're looking at the immune system from our presentation before. Looking at micronutrients is important. Vitamin D is one that's important. As a general rule of thumb, in the summer, if you're getting outside, most people are taking around 2,000 IUs is a good spot to be. In the winter, because we're not getting outside, most people need to go a little higher, around 5,000. Again, it varies significantly from person to person, depending on your weight, depending on the darkness of your skin, depending on your diet, absorption issues, but these are, most people can benefit, if you don't know your vitamin D level, about 2,000 IUs a day. I do want to talk about magnesium real quick, because I just had someone, and I rarely have people come into the pharmacy and hug me, and that I changed their life because I gave them a medication. But it's interesting, for nutrients, for certain people that are really deficient on, I get people coming in the pharmacy and telling me I'm their best friend. So there's this past weekend, I've had several instances of this. I had a patient who has restless leg syndrome. They're on ropinirole. The doctor wanted them to start gabapentin. The gabapentin was helpful, but if anybody on gabapentin, for some people, it decreases the central nervous system, so you get tired, you get lethargic, you have issues. There's mixed data on whether or not magnesium can help for restless leg, but for certain people, it can be very, very impactful. So for almost all of my patients who have restless leg, I'll recommend taking magnesium. In most instances, and again, make sure you talk to your pharmacist, magnesium is a very, very safe thing to take. Most people are low. And for this patient, we actually used 6 capsules a day. So of the magnesium glycinate on the right-hand side, he's taking 2 capsules 3 times a day. He's taking this for 3 weeks. He came in and he gave me a hug and he said, I changed his life because he doesn't need to be on gabapentin because he was magnesium deficient. And when you're magnesium deficient, one of the symptoms can be increasing the issues with restless legs, can be migraine headaches for some people. And for some people who have migraine headaches and restless leg, it's not a magnesium deficiency, but some people it is. So it's an easy tool to start with before keep going up on the medications, is looking at which nutrients are we missing. And unfortunately for magnesium, unlike vitamin D, where we can do a good blood test and see where you're at, the magnesium level that you get from your doctor is in your serum, and your body regulates that in such a way as even if you're really low on magnesium, like this gentleman was, his magnesium in his plasma was normal, but your body wants the last place it's going to go low on magnesium is in the blood. So even though it was normal in the blood, his muscles were so low on magnesium that it was presenting as restless leg. So although there's some blood tests that can tell us, for magnesium, it's not one of them. Another reason I brought this up, a lot of people know magnesium and take magnesium for different things. There's different forms of magnesium. The cheapest one is magnesium oxide. Magnesium oxide can be helpful, but the absorption is very poor. So I use magnesium oxide a lot for my patients. If you have constipation, we'll use magnesium oxide because you don't absorb much of the magnesium. It helps as a laxative. But if we're looking to absorb magnesium, we want, and it doesn't need to be magnesium glycinate, but we want a magnesium bound to an amino acid. So magnesium glycinate, magnesium malate. These are things you can use at lower dosages. So you see the difference here. There's 500 milligrams of the magnesium oxide. So we think someone's getting more of that versus the 150, where in reality, the absorption of the magnesium glycinate is about 8 times higher. So somebody is actually getting about, say, 800, 1,200, compared to that, like if you compare them, 1,200 milligrams of magnesium oxide in the magnesium glycinate, and the absorption is better, so you have less bowel issues. So you can't compare these apples to apples. You're actually absorbing more magnesium out of the magnesium glycinate, even though it's 150 milligrams versus 500 milligrams. And it's not that magnesium oxide is bad. It has its place, but again, that's where the pharmacist can come and help. What's our goal? So if I gave this patient 1 capsule of magnesium glycinate, he probably wouldn't have had improvement. But because we titrated it up, that's where he had improvement. And his doctor called me and was like, thank you. And now he's going to recommend this for his other patients. So magnesium's helpful, but just know there's nuance. And if you have questions on how to take magnesium, let me know. And this is just showing some magnesium oxide. If we look at the uptake, about 9% versus the chelate magnesium, that just means bound to amino acid is about 80% higher. So just because something has a higher milligram doesn't mean you're always going to be doing better from that, unless your goal is to, if you have constipation, you can use that. So with that being said, I didn't tell you guys what to take because there's no way to do that, but I hope I provided some insight into kind of what the thought process should be for dietary supplements, why there's actually more nuance in choosing dietary supplements than there is medications. Quite frankly, as computers and AI and things get better and better for algorithmic medicine, for taking medications, because we have a lot of studies, and taking those from an algorithm, a computer almost can do a better job of suggesting a particular prescription for somebody than a person could, than I could. So it's something that we're using computers alongside of us, but we need to do a better job of looking at dietary supplements, not just saying medications are bad. You should focus on nutrition, dietary supplements, or dietary supplements, expensive urine, just take medications. It's somewhere in the middle, and that's where I think, that's where I'm trying to take. So if our hometown pharmacy, we have 75 pharmacies throughout Wisconsin, and I'm working with the other team of healthcare professionals. We're helping to train some of these pharmacies, have the pharmacology knowledge to help people navigate the supplement world better, because right now, unfortunately, there are some good people doing it, but most of the information on dietary supplements are online articles or from marketing companies. But at the end, so the most common dietary supplements, these are after doing dietary recalls. Again, the studies will vary. My bias is having a good, high-quality multivitamin for most people is a good place to start. So if you don't have any issues, don't have any disease states, don't take any medications, eat a pretty good diet. We could get a lot more specific, but taking a high-quality multivitamin with some extra vitamin D3, maybe some magnesium can be important. And when I go through dietary recalls, a lot of people are getting a lot of carbohydrate, they're getting a lot of fat, but a lot of people are missing protein as well. That's where protein shakes can come in handy. You don't need to drink a protein shake, but you see bodybuilders and weightlifters is drinking protein shakes, and they're probably the person that needs them the least, because they're the ones eating chicken breast and steak all day, so they probably don't need any more protein. But protein shakes can be a good tool for people who don't eat enough protein, and that's something that some people, as we get older, we don't eat enough protein, and there's some good tasting protein shakes. EPA and DHA, so these are fish oils. You might have seen some studies recently saying throw your fish oil away, you don't need it. And there was a bigger study that showed high-dose fish oil wasn't as protective to the heart as they thought, but there is other nuance within there. When you look at other studies for people who don't eat a lot of omega-3s, can be helpful to take some omega-3s or just getting some salmon and sardines in. High-quality probiotics. I didn't have time to go through the nuance of probiotics, but probiotics are very helpful tools, but there's a big differences between them. So depending on what your issue is, ask your pharmacist. There's a lot of different ones that we can use and leverage. Orthobiotics, usually the one that I use most commonly. And CBD and Evolve Immune this past year have been two helpful tools for everybody. So I think in closing, it's not that you need to take all of these or any of these. It's just have a conversation with your dietitian or pharmacist and see which ones might be helpful for you. Again, it's going to change from person to person. And if you guys are interested, this is my bias. I tell my wife this all the time. I have a lot of patients here, which is great, but my bias is choose your pharmacist carefully, choose a physician. As always, you guys have questions, feel free to reach out to me. We can be a valuable part of the team, and I'm happy to help. And I do consultations as well, so the majority of our business is a prescription, but I'm helping other pharmacies do this as well. So we do these consultations that I talked about where we do intakes of a dietary recall. I'll look at your most recent labs, I'll look at medications. And a lot of these consultations are based around specific goals. So someone might get diagnosed with osteoporosis. Hey, I have to go on alendronate. What can I do to help decrease this? Or it might just be a general, hey, JJ, I'm taking all of these dietary supplements. These are the medications I take. This is my normal diet. These are the issues I'm having. Which ones can we pare down? Which ones might you add? And a lot of times, it's something that we can help pare down a lot of things that people don't need to take, and I'll make suggestions to add things on. So these are consultations that I do, and I know people have gotten a lot of value from them, and hopefully in the future, we'll get provider status, so I'll be able to bill insurance. Right now, we can't bill insurance for these supplement consultations, so there is a $200 fee for the initial consultation. I've never had anyone tell me it's too much. And then there's a $100 fee for a follow-up consultation. And again, I spend a lot of time together. And I do recommend some labs, and we do labs as well. So there's a lot of wellness companies that will recommend like thousands of dollars worth of labs. And they can be helpful. And for certain people, we'll do there's labs called omega-3 index, which measures omega-3 in your red blood cell, vitamin D. We'll do a carotenoid scan in bodies. So there are labs that we can do, but I'll let you know if it's worth it or not. A lot of times we can know a lot just from looking at diet and your health history. But with that, I want to tell you guys thank you for having me, and I think I went over, but I'm happy to stay for questions. I'm fortunate to have a great team at my pharmacy, so I actually have the afternoon off. It's not too hot. I'm going to take my dogs for a walk, but I've got time to stay with you guys today. And if you guys do, I go on and off making videos on our Facebook page, and then I've done quite a few presentations. So on our YouTube channel, just like this presentation will be up there, I have presentations on our YouTube channel as well. As always, feel free to stop in with that. I just want to thank you guys, and I'll open it up for questions.
I've got arthritis, and what would you recommend as an occasional, very occasional pill that I could take when I'm going somewhere that I can get rid of some of the pain anyway?
Gotcha. Perfect. So the question was, this gentleman has arthritis. When he's going places, he wants something that can be helpful on occasion. And as a pharmacist, the first place that most people think of and start, and this is something that as we get older, we probably don't want to, so my mind immediately goes to NSAIDs of ibuprofen, naproxen, but for the most cases, we don't want to go there. So for occasional pain and stiffness, what I like to use a lot that doesn't have a lot of risks is a high-quality CBD oil. If it's a specific joint, like hands or feet, it actually penetrates. So if someone has like carpal tunnel or arthritis in their fingers, using a topical can be more effective because it gets the joint. But if it's a bigger joint like a hip or a knee, taking an oral CBD can be helpful and is usually the place that I start for people for occasional. The other one you'll hear a lot of is glucosamine and chondroitin. For that one to be effective, and it's effective in about 30% of people, you do want to take it on a consistent basis, so that would be ones you have to take more consistently. Another one more consistently would be collagen. You can get this from bone broth, but that's something you need to take consistently. And then if you're not in any blood thinners and your doctor's okay with it, we could look at taking some more natural anti-inflammatories. I have a lot of people who will take kind of just as needed turmeric, and turmeric or curcumin doesn't get absorbed well, but it decreases inflammation in the GI, which can decrease inflammation. So the two, long answer short, without knowing more about you, as long as you're not on warfarin, a high-quality CBD, if it's a joint like the hands or feet, topical, or a natural anti-inflammatory like curcumin or turmeric could be two things you could consider. And if you have it, the thing that I usually tell people is it's better to prevent it at a certain point, when you have arthritis and not much cartilage there, we need to do more movement work. So this is where I usually refer people to Dr. Eric Taylor for physical therapy. And then I'll increase omega-3s can be helpful consistently. And then collagen is something that can be helpful, but it's not going to work immediately. It's going to be helpful down the road. But thank you for the question. But yeah, so CBD or turmeric can be good, helpful things as needed. Any other questions? Yeah. I can repeat it too.
The CoQ10.
Yeah.
Having had a heart attack, and I do have high cholesterol, so I am on a statin, that is generally a good recommendation. If so, what brand or what do you recommend?
Yeah. So that's a good question. So CoQ10, someone's on a statin, had a heart attack, is CoQ10, the first question is CoQ10 a good thing to take? And yes, it is. And CoQ10 has very, very little risk with it, and the data is mixed, but it has been shown to be helpful for increasing ATP in the heart, so helping the muscle of the heart. And then the other thing it's been shown to be very helpful with, if you're on a statin, there's this enzyme that statins inhibit, which will decrease LDL cholesterol, which is a good thing, but then from that enzyme our body makes CoQ10, so you have less CoQ10 production. So that's why, particularly when you're on a statin, or if you had a previous heart attack or a previous heart issue, maybe you had a stent, taking CoQ10 is a good idea. The product that I recommend the most for that is Orthomolecular, so the company out of Stevens Point makes one that's in an emulsified liquid. So I think a good litmus test for CoQ10, if you have a CoQ10 gel capsule, is to take the gel capsule, cut it open. If it's a homogeneous liquid without little precipitate in it, it's probably a good one. If there's precipitate in it, you're probably not absorbing it. So first and foremost, if you're taking CoQ10, make sure it's not a powder. It should be in an emulsified liquid. My go-to one is Orthomolecular's CoQ10, just because of how transparent they are with me. I'll be able to see their plant. And the dose varies from study to study. Anybody who's on a statin who had a my bias is to dose a little bit higher in the 300 milligram range. But if you're not having muscle cramping, muscle pain, you probably could do just fine at 100 milligrams. So, but just making sure you're taking that with some food and making sure that's a mixed meal that has some fat with it. So I would suggest a 300 milligram emulsified CoQ10, and Orthomolecular is my preferred company for that. There's other good brands as well, but that's the company that has been most transparent with me, and I know they have a good product. You're welcome. Awesome. Yeah, Vern.
Are there any natural supplements for sleep issues? Because I hear that a lot around here. What would you recommend for people with sleep issues?
Yeah. It's a big question. So it's a good question. Is there any natural therapies for sleep issues? And there are. And I want to make a caveat is there's a lot of different underlying causes for sleep issues. So the first thing that I always tell, there's a lot of undiagnosed sleep apnea. So before even going to making medication or recommendations, I'll usually, if you're having sleep issues, talk to the doctor, because even people who don't snore, there's a lot of undiagnosed sleep apnea, which we've found in our patients. They get a sleep study, they get a CPAP, and it changes their life. So just know that the recommendations I'm making for sleep, it depends on the underlying cause, but there definitely is. And the most common one that we see in the pharmacy that's kind of been the most effective is your circadian rhythm gets off, and that's where it's the easiest to use a dietary supplement. So as we get I think I have a slide on this. As we get older, our melatonin production goes down. So the first thing, and most people take melatonin and say it doesn't work for me. So the first thing I will do with people who have sleep issues, I'll say, how can we increase your body's natural ability to make melatonin? So before going to dietary supplements, the first thing is, and it sounds kind of weird, but getting outside when you first wake up in the sunlight, and not staring at the sun, but being outside without sunglasses, that UVB radiation from the sun, again, you don't need to look at the sun, just go for a walk or read a book outside for about 10 minutes. As soon as you wake up, that tells your body's internal clock, okay, it's morning, and then you'll have a cortisol spike like you should. This takes a little while, but going out, so the first thing I'll tell people is, in general, going outside in the morning, getting some morning sunlight, no sunglasses, don't stare at the sun, otherwise Dr. Ryan will, at the Inside Eye Care, will get mad at me. But having some natural light into the eye is helpful. And the blue light from the sun is way more intense than the blue light from here. So I always hear about the bad effects of blue light. We actually want to get blue light in the morning. So getting blue light in the morning. Then the second thing is at night. To help produce the melatonin is decreasing blue light at night. So that's where the blue blocker glasses can be helpful. And then that takes about a month to your body's circadian rhythm to reset, and then your body helps you to make more melatonin so you can have a little better sleep cycle. From there, and again, it depends from person to person. The things that I recommend, so I'll recommend a lot, just a low-dose melatonin, 3 milligrams, magnesium glycinate, 150 milligrams, and L-theanine. Those three work synergistically together to help, it's called alpha brain, so it helps to kind of turn your brain off, because I'm sure a lot of you guys do too, if you're things at the end of the day, you're just thinking, okay, what happened throughout the day? So in addition to a good nighttime routine, whether that's reading a book that's kind of boring, or whether that's just watching a mindless TV show with your blue blocker glasses on, adding L-theanine and magnesium glycinate and a low-dose melatonin can be helpful. In the product that we compound is called Evolve Sleep, so that's something that I'll recommend quite frequently to people about an hour before going to bed, and that can help to set the circadian rhythm. And sometimes there's other things going on as well, so if it's more anxiety related, and it's more just can't turn off the brain, or it's hard falling asleep, CBD actually, and it seems like CBD is, and I'm not a CBD salesman, I don't have any CBD products, but it can be helpful for helping to calm down at the end of the day. So adding like 10 milligrams of CBD, just a low dose CBD, is another thing that can be helpful at night. So from a dietary supplement standpoint, magnesium glycinate, which we showed, can be helpful for a lot of different things. L-theanine, melatonin, and CBD. The things I'd make sure we avoid is the NyQuil, the Unisom, and those things. They can be helpful on an as-needed basis, but they'll cause more grogginess during the day. So if we can avoid those Unisom and things, it'll be helpful. Then there's the other thing of it. Some people can fall asleep, but they wake up in the middle of the night. And I need to do, because there's a lot of people that are coming to mind right now that I need to do a better job of recommending this. That's where ashwagandha can be helpful. Ashwagandha is an adaptogenic herb. It can help some people in the middle of the night have a cortisol spike that gets them up to go to the bathroom. So ashwagandha, taking that before you go to bed, if you're okay falling asleep but you get up in the middle of the night, can be a helpful tool as well. And then if the issue is getting up to go to the bathroom, that can be another reason for a sleep loss. It's front-loading liquids at the beginning of the day and not drinking so much water before bed. For me personally, as you guys can see, I have a lot of energy and I run very hot, so I'm sweating right now. So at night, another tool is actually temperature. And a lot of people don't wake up because of temperature, but you can get into a deeper sleep if you sleep at a cooler temperature. So my wife is a cool sleeper, so she doesn't like to. She says in the winter, she says, JJ, you need to turn up the heat. It's too cold in here. And I'll say, no, we need to turn it down. It's too hot. But there's a product called the Chili Pad, and we don't sell this. I have no no connection to the company at all. I just use it and it works very well. That lowering the temperature in your room is helpful, but actually for staying asleep, having your body at a cooler temperature, as long as you can tolerate it, is helpful. So the chili pad is a device that has a two water containers, and then it shoots water through these tubes. The tubes are very, very small capillary tubes. You can't even feel them below you. But there's 2 zones, so my wife will set her zone at like 78, and I'll set mine at 55. But you can, controlling temperature, even if you don't think that's what's waking you up, sleeping at a cooler temperature is something that can improve the quality of sleep, and that can be very helpful. So the reason I'm kind of hesitating to, and there's a lot of different reasons, and there's a lot of different potential things that can help. But first, we want to rule out, is there any other underlying medical conditions like sleep apnea? And again, it's really underdiagnosed thing that when fixed can be helpful. Or is there a problem with getting up and going to the bathroom in the middle of the night? Then we might need to use saw palmetto or a medication. Or is there a circadian rhythm issue? Then we might do the lights and the decreasing blue light at night, or adding melatonin. Or is it more of a stress thing where maybe we can add some ashwagandha at night, and during the day maybe it's trying to get more activity in. So for me personally, on days where I'm relaxing more than I'm used to, I have a lot harder time sleeping. So if I get in some time during the day of not bad, but higher physical stress, and each person is different, which is high stress for them, of a workout or going for a walk, I'll sleep better. So there's a lot of different tools that we can leverage, but the place I'll start for dietary supplements, Evolve Sleep, which has some melatonin, some magnesium, some L-theanine, ashwagandha, or CBD. All right, thank you. I think there's a question in the back.
I had cataract surgery earlier this year, and the eye doctor recommended taking AREDS 2. Is there anything comparable, another product, than just AREDS 2?
Yeah, that's a good question. So cataract surgery, the doctor recommended taking AREDS 2. And AREDS 2, for those who don't know, it's actually an acronym. It's Age-Related Eye Disease Study, number 2. So they had a study on this specific formulation, and it was actually, the study was related to macular degeneration, but and not cataracts. But in general, most people can benefit just because of I'm not an eye doctor, but when I talk to different eye doctors, that's because we're looking so closely all day, and we have this constant stream of blue light with screens. We don't have these bursts of blue light, the no blue light at night. What's in the AREDS 2 is lutein and zeaxanthin, which is actually in your retina. It's basically the pigment that helps as an antioxidant. So AREDS 2, because it was in the study, that is one that I'll recommend, that specific brand. So that's one that is marketed, and actually, unlike Prevagen, AREDS 2 is a good product. So particularly if you have a family history of macular degeneration, you have macular degeneration, taking AREDS 2 is great. A product that I like better than AREDS 2, and again, AREDS 2 is a good product, is a product called AccuView. So it has the lutein, zeaxanthin, it adds some alpha-lipoic acid, which wasn't in the study, but it's been shown that alpha-lipoic acid can be helpful too for eye health as well. So my bias is, even if you don't have eye issues, taking some lutein and zeaxanthin, and you can get these carotenoids from various fruits and vegetables, carrots and things like that, but taking some of that is a good safety net to help preventing the progression. And the specific study was preventing the progression of macular degeneration, but AREDS 2 is a good product. If you're looking for something that, in my opinion, is a little bit better, I like a product called AccuView, which has the lutein and zeaxanthin and other things, but it adds alpha-lipoic acid. But AREDS 2 is a good product. Thank you. All right. Awesome. Excellent. And then with that, I do have some handouts up here, so if you guys want, the first one is What do I eat? So if you just kind of want to go through your diet, it's a good kind of general overview that actually the Dr. Williams, who's a professor at the UW-Madison, was one of my professors, created this sheet. It goes through your diet, and it goes through what most people are missing from their diet, and then it talks about what foods to get them from. So it's a good general place to start if you say, hey, you don't want to do a deep dive consultation, but what things could I add in from a dietitian standpoint that could be helpful? Next sheet is just more info about myself, my consultations. The other one is a sheet about our pharmacy, and then the last one is just my card that has my email and our phones. If you have any questions, feel free to stop in. But thank you guys for coming, and I hope we can do more of these. It's exciting to see people's faces and get out, so appreciate it. Thank you.